Trachoma is a blinding eye infection that passes from one person to another, and it's characterised by repeated bouts of reinfection. We used to call it sandy blight, but it disappeared from mainstream Australia 100 years ago, and Australia remains the only developed country that still has trachoma in the Aboriginal communities. And a few years ago, the prevalence of trachoma was over 14% in the kids in these remote communities. So there's a lot of work being done now to try to eliminate trachoma globally by the year 2020, and Australia's part of that commitment. Trachoma exists in areas where personal and community hygiene is poor, and it really revolves around the spread of infection from one child to another because of their dirty faces and the chlamydia organism being on the dirty faces. So the key to controlling trachoma keeping every kid's face clean. One also uses antibiotic to reduce the level of infection, and there's the safe strategy that includes surgery for the trichiasis and environmental improvement so the kids can wash their faces. But in the Aboriginal communities, the hygiene is still poor, and there are 53 other countries around the world, all developing countries, where trachoma is a problem, but there's major efforts being eliminated. So it's also really important in Australia that we continue these efforts to eliminate blinding trachoma. Several years ago, we developed a training module on trachoma so that the clinic staff can learn the basics that they need to know about trachoma, how to diagnose it, how to manage it, and what it's all about. So this was designed for use by GPs, by nurses, by Aboriginal health workers, other people in the clinics. And then this has recently been updated. There was a change in some of the national guidelines, in the summary of national guidelines for the management of trachoma. So the new trachoma module has been updated with the current guidelines incorporated. I think what's important about these modules is that they are available online so that people can access them any time of day or night. I mean, they're available 24/7, they're free, and they do come with CPD points. So I think that they're a really great tool, and I hope people find them useful. The final thing I'd like to say is I'd really like to thank the Aspen Foundation for their support in helping make these available. They really are a terrific contribution.